In you man's eyes, what's wrong with the NHS?
So I'm sitting on the table, I'm thinking, what's going on? This girl, yeah, the girls on the table has basically, I've just seen her go and whisper to 2 other girls and doing all of this kind of stuff. And I've just seen them come. She's just brought out the Hennessy, start pouring drinks. I grabbed the 94 Hennessy, I put it here.
Because I think some people think that being a doctor in the UK guarantees financial stability.
But it doesn't.
Bear man, like I said, I was from Marrakesh to Agadir.
Yeah.
So I'm now seeing my left airport my left airport in Marrakesh. My right one's in Agadir. And I'm flying to London tomorrow. So.
Yo people, it's your way Samson call.
Yo, Etiquette, on a known.
Yo, this is Capo. You're now locked in to Still Changing Podcast.
You know what we're gonna do, yeah? I'm gonna be very, very fair in it. So Akin and Chris get 5 seconds to answer before anyone else in it, because it's medical questions, right?
Oh, okay.
So like, them man get 5 seconds to answer, and then after the 5 seconds, any one of you man can answer in it.
Wait, let's just say from now, innit, yeah, that like obviously we've introduced a new thing to the show whereby you know, we might do some punishments. You get what I'm saying? So I think, yeah, the loser should do the punishment.
What's the punishment?
Yeah, but we don't know still. You might are gonna write some as well. Towards the end, innit? So we'll see. But I don't know, bro. I could do punishment as well. You know what I'm saying?
Not in physical, because Liam will just eat that up like that.
Bro, basically, we're all gonna write a punishment.
Okay.
And then we're gonna see like so.
Okay.
Yeah.
So cool. First question: which is the longest and largest bone in the body? 5, 4, 3, 2,
Tibia.
1.
That's the first thing that came to my head.
No. Now it's open to you, man.
Female.
Okay. Alright.
What's the tibia?
Tibia.
It's this one, isn't it? Yeah.
Well, it's a bone, no? So I'll take that.
Okay, cool.
Far off. It's connected.
I appreciate it.
Okay, cool. What does the medical term bromodosis refer to? 5, 4, 3.
Bad cough.
2, 1. Nah.
Is it inflammation of like a breathing?
What does the medical term bromodosis refer to?
Brom. Can you spell it?
Bromo. BROMODOSIS. Nah, bro. Stinky feet.
It's fake, bro.
Stinky feet.
If you don't know,
Stinky
it's fake.
feet. Oh, that's interesting.
Okay, cool.
Medically stinky feet. That's crazy, bro. You're breathing up through your shoe, bro. Like, that's insane.
Okay, cool. This one, you man should like. It shouldn't go to them, man. Innit? What disease is due to improper use or production of insulin?
Oh my gosh.
Diabetes.
Yeah.
Come on. I said, come on. Vamos. I didn't know punishment today. Crazy.
Okay. What blood type is a universal donor?
B+. B positive.
No. 4, 3, 2, 1.
O neg.
Yeah. O negative.
Oh.
Okay.
I just guessed your thing. You said it.
Yeah, I know.
I told the last pod I told you about blood.
Yeah. You know.
This is a plenary.
I want to be O negative. Just say that. No, man, that's too easy, man. Raw. Okay, cool. This is science. What was the name of the first cloned sheep? 5.
Dolly.
Yes.
I'm cold. I need to stop. Stop me. Somebody stop me.
You're cold.
Somebody stop me.
That's a nice one. Still.
I'll be quiet so I can jump in it. Let me chill.
Okay, cool. What does BMI stand for in healthcare? 5, 4.
Come on, bro.
Body measurement index.
No, bro. 2. No. 1.
Come on, Akin.
You guys can answer now.
Nah, we'll let Akin get some.
No, yeah.
Body mass index.
Big man.
You said big man. You said big man index.
No, I said body
measurement.
Well, he said that. He said big man. You said big man index.
Body mass.
Oh.
Right.
Yeah.
Make sure it's in the middle, though.
I thought he said big man index. I said, what?
Oh my day.
Oh no, the thing is up there, bro. Look.
That's not up there. It's the up one.
Oh crap! No, you might be right still.
Yeah.
How did this happen?
Guesswork, bro.
Calm.
Yeah, that's calm.
Yeah, cool. Yeah, you were close.
Body mass index.
Wale's taking a piss. He's like, fam, let them get some.
I can get
He's
some.
taking a piss. Nah, that's too brazy. What is the largest organ of the human body? 5.
Skin, no?
Yes.
Cold.
Yes.
I was about to say like small intestine, you know.
You know what?
But inner organs, correct? No.
Inner organs, probably the intestines. Yeah.
So that's actually it's a
Cut them up,
pass.
open up. It's large.
You stretch them apart as well.
Yeah.
Raw. Which human organ has the ability to regenerate itself? 5, 4, 3,
Skin.
2,
Oh.
1.
Liver. To be fair, skin's not a bad shout though.
Fam.
You shed it every day.
I thought regenerate like
every day.
fam. If you get a scab, like it's gonna grow.
Slightly, skin can.
I think that's a 0.5 to be fair.
Don't kill me.
So, nah. Fairs.
What disease is caused by the deficiency of vitamin C? 5, 4, 3, 2,
Oh no, yellow eye or something.
1.
Scurvy.
Yeah, scurvy. That's jaundice.
Oh, jaundice. Yeah, that's
So osteomalacia.
Yeah.
As well, yeah.
Soft when you have like soft bones. So your bones
Okay,
are
cool.
fractures and breaks.
Osteomalacia.
Okay, cool. I'll do. Yeah, no, I'm not doing that one. Raw. These are some interesting words, you know. Gosh.
It's a new language, bro. Medicine's a new language.
I can pronounce them. Insomnia, oncology, hypertension. You get what I'm saying?
Just
Don't
easy
worry.
words, fam. What's going on there?
No, but like there's some other ones in it. What is the human body's largest artery? 5, 4, 3. Huh?
I don't know.
Femoral.
2, 1.
Aorta.
Yeah, man. Yeah,
That's
man.
bad for me. I was thinking femoral. I ain't that better than year.
Were you thinking longest or
Longest.
I think it's referring to diameter, thickness. Come on, man. Aorta pumps blood at the heart.
I'm gonna do. Bro, that one is a proper word. Yeah, I'm gonna do that one as the last question, innit? What's the this one? Easy, quick, simple. 2 seconds. You should answer this one. What's the normal body temperature of a human in degrees Celsius?
37, 38, no?
37.5.
It's 37 degrees.
37,
like, yeah.
Oh, swear?
Yeah. Okay, cool.
Give you that.
No, you're not.
That's 2 points.
What's the first
I
one?
said
You got? Skin.
37.
It's boy. What's incorrect? So
It is 37.
37.
you said 37.8 though.
No, I didn't.
No, he said
You did say
I said 37, 38.
yeah. So which one is it then?
38 is higher.
Yeah, 38 is a bit.
38 is higher. 38 is higher.
The men's are saying 38 is high. Guy, please, if you're on this 38, bro, you should praise though. I can't lie. Personally, I think the points should be deducted.
I said 37. It is what it is, bro.
Okay, cool. Let's say easy. Nah, that's too easy, innit? But yeah, nah. Last one, innit? No. I'm not doing that one still. Let me go back to that.
Guys, just narrating the thing, fam.
Yeah, no, I want to let you guys know like my thought process, innit? Which human chromosome carries the least number of genes?
Boy.
5, 4. Huh?
Oh, wait.
2,
X.
1. No.
Why?
Yeah.
Oh, of course. No, you're right. You're
Why,
right.
of
You're
course?
right.
Why, of course?
Because Y is female only in it, but X you carry both. No.
Nah. Why is male only? Why is male only?
Nah, gee.
I like the thought process.
He was the closest one. You minutes. You minutes.
Chromosome. I was thinking like 23, 22.
Yeah. Like my thought
Forgot about
process.
it.
It was always why, man.
That's
Fair enough, though.
So I work in finance, innit?
Yeah, it is. Actually, well done. Still, well done. Everybody, well done. But yeah, quickly, we quickly wanted to touch on because you know what it is. Apart from myself, every man in here is technically slid on a holiday this year, innit? So we wanted to see what it's saying. Cause these two over here touched Marbs.
Oh, you went Marbs, wasn't it?
Yeah. So that's
Of course.
you know, of course. Oh my days, fam. You know this guy. The picture, there's a picture of this guy here. Yeah. He just boxing a Bel Air bottle, like.
So no one can have access to it.
No, I can't. Like, wait.
No, you gotta hide your drinks on those holidays, bro. You get finesse.
I 100% agree. But listen, yeah. See, I told these man, fam. There's something called table etiquette, bro. Please turn to your neighbor and say table etiquette, bro. Because, fam, like, there was a situation here, like, we must have got a table now. And did you go thing? Mirage?
Yeah, of course.
Cool, so if you're there, you're gonna go, bro. It's one of them. It's like black and white, basically. Yeah. Cool. So we've gone there now, and imagine like even before, like, fam, the whole lead up to the night was patterned because it was like obviously, I think we must have gone Nikki Beach, and then just chilled there, nice vibe. Talking to one of the waiters, he was like, oh, he works there as well, isn't it? He kind of does that both there and Mirage. I was like, oh, swear. So I must have called him back before we left. I was like, what, do you think you can like pattern us a nice little deal on the table? He was like, yeah, sure. So he sent me like the list of tables over. I can't. Like, I looked for the cheapest thing. I saw like 2 racks. I said, alright, cool. What can you do it for a rack? Like it's Monday. Like, do you know what I'm saying? He was like, yeah, sure. The man, they were gassed. They were like, yeah, calm. Like, but he must have come back saying, oh, cool. Like, he's talking to the owner. They're only gonna knock off like 5 bills, innit? We were like, cool. That's calm enough, innit? Literally. So cool. Like, you know, we're excited.
Table,
bro, gee,
that's on the head of.
Bro, I'm sure. And the thing is, bro, we were on the floor, by the way. So like they've even basically bumped up our package, basically. So we've got 1.5 for something that was maybe worth like 4. Do you get what I'm saying? Yeah. So we're gassed. And the thing is, there's no like that 1.5 wasn't a reservation fee. It was just like you just spend that straight on bowls. So that's why, bro.
It's like a bar tab, basically.
Literally. So we looked in the menu. We saw 42. We saw Henny Sexo. We said bring. You get it? So we've done that now. Cool. And obviously, yeah, as these things kind of go, bro, like once you're on the table and the bottles have come, you just see people start sliding towards the table, as if you didn't see me when I was here before. Yeah. Cool. So cool. We've invited some people to the table now because really and truly, like we're not all gonna finish these 3 bottles ourselves. You get cool. So these men are here now, yeah. And then at one point, like I'm with 3 other brothers. These men all just blew out. So I'm sitting on the table. I'm thinking, what's going on? This girl, yeah, the girls on the table has basically. I've just seen her go and whisper to 2 other girls. And doing all of this kind of stuff. And I've just seen them come. She's just brought out the Hennessy, start pouring drinks. I grabbed the 94 cents, I put it here. I was knuckling the thing, bro. I was thinking, I couldn't believe it. I had my sunglasses up like this. I couldn't believe it, bro. I couldn't believe it. I said, nah. My boys come back. I said, bro, told this girl. She needs to calm down, fam. Entitlement is brazy, bro. Just, bro. And she didn't know these girls from Adam. And she wasn't doing this when the man them were here. It's only when they've left that she was, oh yeah, just be bringing nah, G. Have to knuckle that 40, bro. I had to back.
Those are the girls that'll try rob you,
bro. 110%. I'll be so real. Have to knuckle that 40. I held it here, bro. No jokes.
Yeah, no, man.
Gotta stay away from girls like that, man.
Brother,
I hear it. What's your man's highlights for your holidays then? What you man saying? Even you went in Croatia.
Oh, you went Croatia?
Simple. Mine was like, I went Dubrovnik in Croatia, so that's like quite specific. Because like people think Croatia, they think of like Split. But this one that we went to is more like scenic, coastal, kind of like a chill one. So that was quite nice. Like people that watch Game of Thrones, they'll know about the place.
I remember you were snapping a bit still. Yeah,
it's filmed. A lot of it was filmed there, so it was more of like a sightseeing trip, few island hopping. It was a steady one. It was a very like maybe like 3-4 days, something calm after exams. You know, keep it chill.
Yeah, fair enough.
Liam, what about
me next? So I went Marrakesh and Agadir within Morocco. Yeah, done bare excursions. Because like my sister, she's one of the holiday. Shout out my sister, innit? She's one of like the holiday planners and type people, innit? So every day different excursion. So first went to see the mountains, and for me, like obviously, normally I'll be thinking, nah, I'm not going there. Like, I ain't doing that. So I'm not into that, innit? But when you're actually there, it's mad.
Which mountains to where? Marrakesh.
Yeah. I went to Atlas Mountain. You see waterfalls there.
Yeah. Did you go Uzud?
Yeah, I went to Uzud as well. Like 3-hour drive from Marrakesh.
Crazy.
It was like,
crazy. So what type of like footwear did you take there?
Bro, I was gonna take Crocs, but obviously you're hiking as well, innit? So I took Dunks.
Yeah, you're smart. So we didn't even know the pattern like that. We thought it was just like a quick like a little cut through. And obviously they sweeten up with boat trips. You're thinking calm like fam. So we took slides. G, the way we were ascending on the side, basically like this, literally like bro, it was crazy.
You know,
bro, because we didn't know it was like a proper. We knew it was a hike, but we just thought like we were just kind of cutting through places, bro. Nah, it was crazy.
When I went, I brought my like deadest pair of shoes.
Yeah. So that's advice for anyone going. Bring like
Some
run down
study.
to something you're comfortable
Yeah,
with, you don't mind
straight.
running in or something.
No, holiday planners, like people that really want to plan holidays, is essential in your batch when you're going on holiday.
Bro.
There's a guy like in my batch as well that was like very intent on doing itineraries,
Yeah.
and I was kind of like go with the flow, but it actually makes a massive difference.
Yeah.
It does.
So you have to be like, invested in like, because I'll just chill. Like, I'm happy to just take the time to relax, but then when you
that's
actually
not
get to
what
do
holiday's
stuff,
for.
exactly, you want to step out and people like that.
But the thing is, you always need to plan in like a day where you do nothing.
Rest,
though.
yeah.
No,
Yeah.
that was my next sort of
Yeah.
complaint. Like my body was beat up. After
You did something every day.
I was just trying to every day. Me and my brother were just trying to chill in
the
the pool.
balls.
My sister's like, nah, you guys are chilling there. We need to be up at this time. And I'm just like,
That's the
oh,
thing,
let me
yeah.
just chill.
No, I can't. Like the day after we did the Uzi waterfalls, but we didn't do nothing. Like, we basically just baked off. I think we ate something in the evening, but other than that,
You need those.
gee,
What, you just baked off like in the hotel and just like, or
yeah. Basically, I think we just chilled off. Like there was something we were supposed to do that we were just like we pushed it till later, and then we went to eat like later in the day. Do you get?
okay, yeah.
So like basically, up until we left that day, I don't think we did anything.
Yeah, nah, fair enough then. Now sometimes you do gotta be bakey, but I hear what Wale's saying about that the whole planning thing though. Like even when we went Napa last year, like I was deep in it. If we didn't have the itinerary thing planned, yeah.
Planning when we got there.
Yeah. Planning when you got there, planning when you get there, it's like it's slightly a myth
Not gonna
because,
happen.
bro, because everything might just be sold out and stuff. Do you get what I'm saying? Like,
Exactly.
but fam,
But we bought something before though, so like the boat.
yeah, the boat party and stuff like that.
We just basically landed with like one thing in mind.
Yeah. Essentially,
just book
pre-booked
everything
everything
else
else. Do you get what I'm saying? What's an L like? You man are saying like what's like a downtown type of thing like
In
in terms of in terms of humans.
I took my AirPods, on the for the plane ride, innit? Too tired. I used them for 10 minutes. Told me why I've come back to London with one AirPod now. I didn't use it once when I was there. I used it once. There must have been one night when I was bare tired, innit? So I've dropped my AirPods. Then obviously when you drop your AirPod, you know the AirPod just flies out of the case, innit?
Yeah.
So it flew out the case, but it was near the bed. So I picked it up, put it in. I was thinking I'll get the other one tomorrow morning, man. I was tired. Couldn't see it, because I was looking, I couldn't see it. Then when the morning came, I was like, yeah, cool. Where's my other AirPod now? Searching the whole room. I'm like I shared a room with my brother, innit?
Yeah.
Where's the other AirPod? He's like, well, AirPod, it's not there. Boom, AirPod wasn't there. Then I've now used the Find My AirPod thing, yeah. Bear man, like I said, I was from Marrakesh to Agadir. Yeah. So I'm now seeing my left AirPods my left AirPods in Marrakesh. My right one's in Agadir. And I'm flying to London tomorrow.
You have to budget in that next payment straight.
Bro, fam. That's it, bro. That's the most jarring thing, you know.
Yeah.
Like, fam, the other day, like, bro, I was using one AirPod, fam. I check my pockets and then put it in, bro. The case ain't there, bro. Like right now, I just have my left AirPod.
It gives you a headache when you listen
Bro,
to it.
it's so jarring.
But at least you had one though, like.
Bro, I'd rather lose it all.
I'm not using one.
Bro, like it's the worst thing. It's actually the worst thing ever.
Oh, so you've lost it,
bro. I don't know.
I thought you said you left it at home.
No, it's gone.
Oh, yeah, deep.
Like my one AirPod is at home.
Without case.
Wait, what ear have you?
My left ear.
Might as well give you back.
Link it up. I hear it still. I hear it, fam. That's the pain, fam. There's enough times that like even like can't like not losing in it. I feel like now if I say this story, it's a bit too entitled. But you know when you get on the train, you open the case and there's nothing there. Like no one's there. I'm just like fam. I just have to close the case in silence.
Bro,
chill all the way to work and I have to make other people's conversation my entertainment. Bro.
Said what? Nah, literally. What about you, JR, man? Any
I was
complaints?
saying losing stuff as well. Like, I don't think you can go on holiday and not lose something. Before I even got into my flight, I lost my shades.
Oh yeah, they weren't no normal shades though.
Yeah, they weren't.
They weren't no normal shades.
Luckily, in the airport they had some shops there, and I got it for VAT free, so
okay,
softened the blow a bit. And then maybe just a bit more, just like you were saying about tables, how people move.
Yeah,
see the real people on tables sometimes. Sometimes you just have to turn a blind eye to it, but it's like, wow, really, for a drink.
Well, this is Capo, and you're now locked into the Still Changing podcast.
Yeah.
Scrub it.
See what I was saying? Serious question though, like, let's get shit to it. Like, what's your man's worst like placement experience though? Boy. Like, actually, no, do you know what it is? Let me rush that. What's wrong in you man's eyes? What's wrong with the NHS?
Huh, where do we go? Like, that's a whole pod episode.
I think, my point has been for a minute that like I think it should just get privatized still.
Okay. So I did
because just to give context in it. Yeah. I feel like there'll be now people in the comments saying why
the very techie one.
I think literally, bro, literally.
Yeah, no comment.
I think personally, the level, like the standard that the NHS is compared to other developed countries is very poor. So I feel like to actually like bring it up to where it should be, I think personally like we should all pay for it. Now, obviously, I think it should be somewhat means tested, so that like, obviously somebody who's more well off pays less than somebody who just like tax. Do you get what I'm trying to say? Yeah. However, though, I do feel like when it comes to like, for example, even that specifically, like if you look at all our pay slips, for example, there's a lot of things on there that will just see tax come out, national insurance come out, student finance come out. If I saw NHS on my thing, I would actually understand because I know that cool, this is going towards something that is actually going to improve everything. Do you get what I'm trying to say? But
no, but you see the tax that you pay out of that budget is the NHS.
It is,
yeah.
But let's look at it clearly needs to be more.
You know what it is at the same time.
It's like how much can you keep increasing the budget? One of my friends does a degree, and they look at the structure of how like the NHS, and it's like if the NHS was like to continue like increasing. I mean, if England was to like increase the budget to like meet the needs of the NHS right now, in like 10 years, it would be like something like 60% of the budget. Yeah. So it's like you can't like it's opportunity cost. So it's like when you allocate more funds to the NHS, you're taking away from other things. Okay. But I feel like it's not even a funding problem. I think it's more to do with the structure of it, to be honest.
Yeah, I mean, this is the reason I took a year out, because I wanted to kind of see healthcare from a different perspective, from a business perspective, because I think as medics, we're kind of trained to just view your role as, I'm a doctor, I'm here to treat X, Y, Z, that's all that matters. Whereas when you zoom out a little bit, you find that there's so many other things that interact. And I think with first of all, the way you view healthcare is the reason. That's how it depends on how you finance it. Because people don't view healthcare as a product or a good. They view it as a right. Or
business.
They view it as and that's why the NHS was created. You know, Beveridge and Labour, they were the ones that fought for that. Yeah. So it depends on how you view healthcare. First of all, that's why if you say privatization of the NHS, everyone just go like, oof, they get a bit uncomfortable because of the way we view healthcare in this country. Very different to the way they view it in the US. Hence why it's so different. But then when you look at the NHS now, look, it's done so much, 75 years. Yeah. And, you know, we can all say that we've been to an appointment, we haven't had to pay anything. Yeah. And we're like very grateful for it. But I still think the way we view healthcare in this country, in terms of like, we fix it and then we leave it, as opposed to preventing it. I think the way we view healthcare as a culture is probably the reason why there's so much pressure on the NHS, because we're still kind of being reactive and not proactive. Because if you think about it, like when someone is ill, you're thinking, oh, let's just fix that patch, because at the end of the day, that's it, we sorted it out for them. But maybe if you look back at that person, you're like, wait, hang on, the living situation they have, the house they're living in, all of that is also playing a role into their healthcare and into why they're coming back. Maybe we should actually start diverting attention to the communities, the councils, how they actually help these patients, because then that means it reduces pressure on the healthcare system, and you find that we can still have an NHS because all of those things have been alleviated. So it's not just down to the NHS; it's higher powers.
But do you not think even in that now, like there's time that goes away from someone's role that has to look into that, for example, because like what I mean, even like the people that you man say, like the doctors that are teaching you, man, they're done with it, but
they get paid for that though.
No, but like that's within their hours, right? Their normal day hours, so they're obviously taking time away from other patients. Yeah. So it's like, for example, if somebody's treating somebody, they have to look that deeply into somebody's situation. How many patients could they have looked in that time, for example? Do you get what I'm saying? So
it's limited.
I feel like even like my thing is even also like bolstered by like a quality issue as well, because I'm sure a lot of people like you man are studying with as well, looking to like go private or go states or go dupes or something like that. And like obviously, if you just look at even just the pay that's going to NHS, doctors, nurses, whatever, like surely if you know that you've got quality, you're looking elsewhere. Do you get what I'm trying to say?
But it's about how you define the quality. So I think when you look at the targets that are set and the quality that is set, it's what we call it in the NHS is a fee for service. So we define it as you do this surgery and that is a success because you've done the surgery. But then you're like, wait, hang on. Just because I've treated that patient, does that mean that that's good quality? Is that a good quality outcome for that patient? Yeah. Because yes, they are able to, you know, walk now. They have their knee fixed. But then what about if they still want to be able to garden? They can't do that anymore because now the procedure that they've had prevents them from doing that. So then you have to maybe look at what that patient values. And that's where healthcare is moving and transitioning. Yeah. But the NHS is still kind of lagging behind that. Okay. So it's the way we view outcomes and healthcare. And it's a lot complex, and you know the NHS is moving in a direction where they're trying to keep people in this country because you know I'm sure you guys hear about guys going to the States, Australia, New Zealand.
What, like doctors
leaving, even
That's
nurses,
right
because
now.
it's like for what they're doing, they ain't getting the money they deserve.
No, literally, like I remember talking to someone not too long ago. She's she's a graduate nurse, and she was like, fam. Yeah, like I was like, oh, like what? Like what's that saying in it after you've graduated and that? She's like, it's cool, but I'm definitely leaving though. Like I'm not doing nursing.
Fam, that's what I'm saying.
Already, like straight a year in.
Brother, the people, those two girls I was speaking to, I think they're maybe like second year. So I think like maybe they met a couple third or fourth year medics. They were like, oh, what year you man in? It's the second year. So calm, you still have time to exit then. You need to cut out. Like they were saying straight, you need to blow out of this place, fam, because it's like it's just crazy.
Do you man so like what? Do you man regret picking medicine then?
No. Achieving the degree in itself is a fulfillment anyway. Yeah. How you've done it. And like, I feel like the learning experience of it that is invaluable. Like, and like whether you stick to medicine or not, the things you've learned in the process. And I feel like it's good to I wouldn't want to live in regret in it and think, oh, what if I done medicine? What if I done this? What if I done that? And I'm like a lot older when I don't want to go back and do the degree. But if I at least do it and I know cool, it's not for me, at least I know that through experience. And like I said, you can use that experience in any other sort of sector, you know.
The way I see it is, like, as a doc, you're the ultimate problem solver. Because someone's going to come to you under, like, dying breath. You know what to do to fix them. So it's like, that translates in many facets of life. So, like, you become a problem solver. You put me in any situation, I'll be able to, you know, systematically use, you know, my knowledge that I can find on the internet to break down this problem and find a solution. So, like, what I say is like you're bigger than your degree. So it's like my degree does not define me. So like medicine might be my passion, but it might not be what makes me really, really rich. But like it's still something that I'm happy to do.
I think if you go into it thinking that you're gonna hit the lick, because I think some people think that being a doctor in the UK guarantees financial stability,
but it doesn't.
But you do get into a position where after a couple of years you do get into a position where you're calm. But like I don't think you go into being a doctor for the money because of the role you have to do. Like, you know, when you told about that story about, you know, there was poo on the ward, like you're dealing with like very vulnerable patients. You know, places where you can actually, you know, feel a bit unsafe as well, because these are humans that are, these are people that are like these are people that are like in a very techie position, and you're the one that they're relying on. So for you to now have financial motivation on your mind in the role is kind of like, that's not what you...
But do you think so though? Because I feel like, I mean, obviously I don't want to sound too like altruistic or whatever, but it's like, obviously for certain roles, there should be a good reward for it. Do you get what I'm saying? Like people, like for example, like firemen, doctors, like you'd expect that. Cool, if you're doing something that's really important, like surely you should be compensated fairly. Do you
know what it is? It's literally just the framework of this country that doesn't allow like compensation that people may feel like they deserve. So like you can't do nothing about it. Like it's either you don't want to be in this system, you fly out, you start somewhere else. Like if you're doing medicine for the money, you should not be in the UK. Like that's literally it. Like if we actually want peace, like we know what to do, bro. Like we'll be in America right now.
So what's the like actual pay differences? So like if you let's get into the figures.
So an average F1
Please, can you break down small?
Okay, cool. So we're in medical school right now. So we're medical students. When we graduate medical school, we'll be junior doctors. And then junior doctors are anyone up until a consultant, so a senior doctor. But the starting parts, so if you want to talk about it like law training contract, baby, that kind of thing, it's maybe like a foundation year 1 doctor. So that's when you leave medical school after your first year. That's the first job you do. Starting salaries around 25k for if you're in the UK, but if you're in London, it's a bit of a premium, so it's about 30k. Can go up to about that, and then your second year that rises up to maybe 30k for the rest of the UK, and if you're in London, maybe around 35. Now, if we're looking at the US, where once again it's a different healthcare system, coming out of medical school into your equivalent, probably around 50-60k.
Crazy.
Pound sterling?
Are you crazy? That's why these men love singing City Girl. Bro, these men don't make it. Bro, that's outside.
So as a doctor now, so now like you're actually a doc. Like, what's the difference between that UK?
Okay, so like doctor now is when you've moved from being fresh out of medical school, the first 2 years, you're now maybe looking to go down a certain path, maybe be a GP, be a surgeon. Then you start to earn in the UK roughly around £40,000, and that keeps going up and up and up till around when you get to consultant, which is a senior doctor. So those are the people that are very experienced. That's about 60 to as much as you want to go up to 6 figures. But that's all dependent on your experience.
And that's, we're talking like what, like 15 years?
Because like a surgeon probably on average spends around 10 years training, studying. I remember you're doing exams, like we still got exams to do throughout your career.
You got your whole career.
If you're a surgeon,
you got to pay for those exams as well.
Pay for
your surgeon
yourself.
A lot of them you got to pay for those exams, and if you fail, you got to pay for the research.
You got to pay a fee to be a doctor.
Can't even expense it to anybody.
No, but that's if you're a surgeon. Like you have to do exams. Like you can't just be like you have.
Obviously.
Like if you were being treated by someone, you want them to be as clued on. Like I always, that's the example I use. Like you want your doctor that's going to be treating you at your last moments to be clued on, know their stuff. So that's why.
Can you decline that service from someone? Like, I don't want to be treated by you.
You can, within your own rights. Yeah, you can.
Definitely.
Nah, that disparity is too crazy, bro.
No, but like it also does come with a lot of risk as well because it's like in America is private, so they have to deal with a lot of like lawsuits and stuff. So any like problems with patients kind of goes off out of their own pocket. Whereas like in the UK, you're protected by a whole like bodies,
defense unions.
So there's benefits both ways. But if you're actually looking in terms of just being numerated, like America would be the best place. Of earning potential.
Some people like to do the middle ground thing though. They go to Australia, New Zealand because to go to America, first of all, it's a significant investment as a UK student because you have to do exams to go there.
Also,
you have to do it like tough exams,
medical exams,
free exams.
like license USMLE. Like you got to do licensing exams to practice in the States because our degree doesn't transfer over. Whereas in Australia, New Zealand, your degree's calm there, so you can just go there and you're probably earning not US level, but you're in the middle, and it's a different country as well, so the work-life balance is a lot better.
I've heard Australia's clean still.
Very stress-free. It seems it though.
It's
do you know what I mean? That's the only issue. Like
my parents feel it last year, but they say it's lit, bro. Like literally, this whole thing of like basically, because obviously, like when we used to live in South Africa, Australia was like the flex. Like people would be like, I'm moving to Australia, but that's like them saying like, fam, I'm actually I've gone clear sort of thing, innit? Because to them, like obviously SA is a lot of like obviously a bit of crime and that kind of thing. Obviously, each country has their own thing, but like, literally, do you get what I'm trying to say? Like, it's rife out there. So they're looking at Australia like, fam, this is the way out. Do you get what I'm trying to say? Because in there, it's like they always say the same thing of selling dreams. Like, like people just leave their front door unlocked. They'll leave their gate unlocked. Bro, real rap though. Like my parents went there and said, that they just closed the door and they left. Because it's like obviously within that, once you're in that calm neighborhood, no one's doing nothing. Everyone's got bread.
Dubai and stuff like that. And like them and
Dubai they don't still.
Because you better not. You better not. You better not.
My dad was saying, fam, like left his phone there. I think someone left their like phone and wallet there for like a couple hours. Came back, obviously, like I think the person was like they just forgotten it. Came back. Same place. Bro,
do that in the UK, bro. It's
gone.
Second.
They were
just like, bro, where's it gone?
bro, just forget about it, innit? But yeah, nah, man, I can't lie that. But quickly, like, cause I can't lie, time has been fast spent. But yeah, wanted to ask, like, what's your man's worst, placement experience, or most like, what's the maddest thing that's happened to you, man, on placement?
I'll say like the most notable one for me